Have you been told that slow motility is the reason that you're constipated, bloated, or dealing with digestive issues that just won't resolve? Or have you tried to quote unquote treat motility with supplements, laxatives, diets, or protocols only to find that nothing actually sticks? Or maybe you haven't been formally diagnosed with slow motility, but you've been Googling what it means, and all signs seem to point to slow digestion, sluggish bowels, or food just not moving the way it should. If any of that sounds familiar, then this episode is for you. Today, we're continuing the Real Root Causes series, where I'm taking conditions that are commonly labeled as your root cause, and I'm breaking down to you what their real root causes actually are. This is super powerful because understanding a fake versus a real root cause is the difference between finding healing from your symptoms or not. Today's topic is slow motility. Slow motility is a common diagnosis I hear clients get from a doctor who explains to them that slow motility is why they have their constipation, acid reflux, bloating, or usually some other digestive issue. The solution, according to the doctor, is to either get used to it, maybe get surgery if the motility is bad enough, or go through a merry-go-round of supplements or medications that are designed to quote-unquote help slow motility, but don't really work or relieve your symptoms. And hint, there's a reason why. The reason these methods don't really help slow motility is because slow motility is not the root cause. It's actually being caused by something else. That's why on today's episode, I'm breaking down why treating slow gut motility with supplements or medication rarely works, the real causes of slow gut motility, how to test for these root causes of low motility, and what you actually need to address for motility to return naturally. Hey friend, welcome to the Better Belly podcast. If you're currently trying endless supplements, doctor visits, and diet changes to heal your mystery symptoms, you are in the right place. We're here to solve the real root causes behind your gut, hormones, skin, sleep, and brain concerns. Literally anything and everything in your body. My name is Allison Jordan. I'm a functional medicine practitioner that has supported over 150 clients just like you to heal problems that no one has been able to fix. You don't need a perfect diet or a random supplement you found on Instagram to heal. You need a proven system that heals your whole body from the inside out. That's what I'm here to share with you, episode by episode. It's time to make health easy again. And just as a reminder, this information is not meant to diagnose, manage, or treat disease. Always consult with your own health practitioner before you make any changes to your health. Hey guys, and welcome to the second episode in our recent series we're working, which is the Real Root Cause series, which we're looking at the actual deeper root causes to words and phrases that often get called a root cause themselves. They're fake root causes, and we're digging into the root causes to the root causes. It's really deep, y'all. Literally, think just dirt. Just think we're planting or we're pulling lots of weeds today, and we're trying to get all the way down to the base of the root, and we're having to do a bit of digging. This isn't one of those easy weeds that comes up when you pull. The whole thing comes up. You just got to be careful about how you pull, and you might have to dig to get the whole thing out. Otherwise, it's growing back. So if you did not listen to last week's episode, I do give a really nice briefing on signs that you have a root cause, like or that you're not dealing with a root cause. And maybe I'll just say it now because it's worth making sure you know this. One of the biggest signs and one of the biggest reasons for this podcast series is when people say, well, I dealt with my candida and it came back, or I take supplements or medicine to help with my motility, but I still can't poop. I'm still constipated. Or I killed H. pylori and I still have acid reflux. Things that people have, other practitioners or blog posts, somehow we've correlated. Someone has said, well, acid reflux is caused by H. pylori, or constipation is caused by your slow motility. And it's just not true. It's not accurate enough. And so when you try to on the nose say, well, if I have motility issues, I'll take a motility supplement, you're never going to fix it because you're not deficient in a motility supplement. You have issues with root causes that are causing motility. Like nobody just gets slow motility. You're not like, whoops, my body decided it wanted to have slow motility. They're actually root causes. So today we're getting into slow motility as a root cause. I'm very passionate about this because it breaks my heart how many times I've been emailed or DM'd and somebody says, I've been dealing with constipation for years. My doctor says that it's because I have slow motility. And basically suggesting that they've internalized that when they were told it's because of slow motility, that maybe they can never get better, or they're like too hard to fix. Slow motility is not too hard to fix. And so I'm going to get into exactly today what the root causes of slow motility are, because every time you get rid of them, every time that I've had a client come in and say they've been diagnosed with slow motility, every time we look at these root causes, they don't have slow motility anymore. As a reference or a reminder, all the root causes we're going through today, I'm not saying that if you have slow motility, you have all of these. You might. But if 10 people with slow motility are in a room, they will often have different combinations of these root causes. And that's why you do want to do testing for all of them. If you have essentially constipation, but especially if someone's told you have slow motility, and it can not just be constipated related. It can be related to gastroparesis, which I've also had clients with gastroparesis who've improved. There could be a lot of things going on with it. So as a reminder, I'm actually drawing out a lot of our information today. If you're a visual learner, if this is like your mojo, just go to betterbellytherapies.com/root and you can download the graphics that I drew for this episode along with our other episodes in the Real Root Cause series for all the episodes we've recorded so far. And if you're a visual learner, go download that. I'm going to try and describe what I'm writing down so you'll still understand it. But I really had a vision, so to say. I really had a vision for doing these episodes with these visuals. So here we go. If we are drawing a plant or thinking about root causes as a type of plant, the top of the plant is all your symptoms. So the top of the plant for slow motility, or the middle of the plant, or like the base of the plant, is going to be your fake root cause. Fake root cause today is slow motility. And the underneath the base of the plant, underneath your fake root cause is all your real root causes. They go down deep into the ground. So just to kind of reference, why would you care about slow motility? What are some of the symptoms you might be having? I'd say number one is going to be constipation. That's the most common connection. Someone says, I have constipation and my doctor diagnosed me with slow motility. It's really not saying anything new. It's like saying I have constipation and my doctor diagnosed me with constipation. It's just repeating the same information twice, in my opinion. But slow motility can be a component of SIBO, like a root cause, one of many. It's not the only one you need to be thinking about. If you want to learn more about SIBO, did I write it down somewhere here? If you want to learn more about SIBO, I have a podcast episode where I talk more in depth on all the root causes. Let me just go pull it up. Because it's another one of those things where it's not a root cause. That's why SIBO comes back, is because you're not dealing with the root cause. It just keeps growing back. Okay, episode 235, and I'll put it in the notes for today. EP 235. Making edits as we go so I don't forget anything. Slow motility. Very first episode mentioned today. Okay. SIBO, bloating can be a symptom of slow motility. Candida overgrowth. It's one of the root causes of candida overgrowth, which next week's episode is going to deal with all of the root causes of candida overgrowth. So if that's something you're interested in, big deal there. Acid reflux, big component of acid reflux. And I have a master episode on acid reflux where I talk about all the root causes of that. It is an episode, just looking at my notes here, 285, episode 285. if you want to hear more on that. Because we're just taking just imagine we're we're doing like a super zoomed in version, super zoomed in view on slow motility. And it's not everything, it's not the big picture, but we're really going to understand slow motility at the end of the day and like what things to test for, what to be looking for, what to treat. All right. And then also maybe like quick feelings of fullness, just food is not moving through and you're having issues. All right. So let me see if there's anything else I'm missing here. One thing to note on fake root causes, just because they're not the real root cause, like the root cause, like it has its own root causes underneath it, doesn't mean that it also won't cause its own symptoms. So all the root causes we're mentioning today will cause symptoms, including slow motility. And then slow motility, as a side effect of all these root causes, will cause its own symptoms. So it's not saying it's not real. Slow motility is real. We're not saying it's not like something that you can describe as a phenomena in the body, the phenomena being your body's not digesting. It simply is, or not digesting, it's not moving food along. And I guess that would be good to describe. For anybody who has not heard me talk about slow motility before, or has not heard the phrase, motility has to do with your body's ability to push food along down the tube. So down the tube, that is your esophagus, your stomach, your small intestines, your large intestines. And there's a variety of versions of motility issues, but you could have motility where motility is like the fancy word for the body's ability to push stuff through. You might be like there's an average rate that things should be passing through. Sometimes like part of your gut has normal motility and the other part doesn't. So maybe your esophagus has slow motility. That can be part of like food feeling like it gets stuck in your chest or your throat. But you can also have slow motility in the stomach, which might be like when in severe cases, gastroparesis. You might have it in the small intestine, large intestine. It could be in most of the tract, it could be in parts of it. And it's just your muscles' ability to contract in a coordinated motion to push everything along and digest it. And if it doesn't do that, things get stopped up and it either doesn't come out the butthole as poop, and you get constipation, or it just slows down and there can be bacterial overgrowth, hence SIBO, or just putrefaction, which is rotting of the food in your gut, which can result in a lot of bloating and gas and really bad smelling gas. And it can also result in things like acid reflux. Things are just not moving along. And this is not an issue of food sensitivities in terms of it can be one of the things that might like aggravate it, but it's a lot of times I have clients say, well, I don't feel good after eating, so I'm going to try and alter my diet. It doesn't really matter what you're eating. Slow motility, just don't care. It's not going to move anything along. It doesn't matter if there's gluten in it or dairy or not. It's just going to be really hard. So this has been groundbreaking for us. When I started my working with other people after healing my own constipation and IBS, I did also have slow motility. It was just wild that I was starting to see a pattern. So we have 7. This is not an easy one. This is not like a simple one. The low stomach acid last week was pretty simple. This is 7 different potential root causes. All right, you guys ready? Number 1, let's see, make sure I write this in a place so you can see it. All right. Low digestive enzymes. And there are 3 digestive enzymes that we want to be thinking about. One is stomach acid, which we talked about last week. Very key. I would highly recommend if you have any acid reflux, constipation, bloating, pretty much all the symptoms we're talking about today. Stomach acid is number 1. Bile is number 2. That comes from your liver. I'm going to draw a little liver. I'm going to draw a little stomach. That stomach does not really look very stomachy. I just don't want to confuse anyone. There we go. And then we have the pancreatic enzymes. So the pancreas. And the number 1 mistake you can make with these 3 is just saying, well, my doctor gave me digestive enzymes. That should fix it, right? Wrong. Your body didn't just decide to stop creating these things. So interestingly enough, all 3 of them have their own versions of root causes. Stomach acid, which is usually the issue, is it being low. That has its own root cause, which we discussed in last week's episode. Go and listen to that. And then bile, it's all about liver and liver health. Sometimes things like fascial adhesions. We're not, I guess, it's not on my list of things, but I know we're going to be doing the Real Root Cause series in January and February. So there's 8 episodes. But if you guys like this, I'll just keep doing it, right? So let me know if you would like it. Come onto my Instagram, DM me. Let me know if you like this. I know some of you guys listen to this on YouTube, even though we're not uploading video yet, but you just like listen to it. You can leave a comment in there. I've been starting to check those. But bile's a liver issue. And if you want to learn more about the liver for any reason, my favorite podcast episode on it is going to be, I have to go grab it, episode 118. The first word is liver. Very, 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 very helpful. Oh, I already have it here. Episode 118. And then for pancreatic enzymes, interestingly enough, the pancreatic enzymes, I usually find it's a two-part issue. There's more possibilities to this, but this clears up like the majority of cases that I've seen. Number one, pancreatic enzymes, part of the mechanism of them knowing to release out of the pancreas is proper stomach acid. So low stomach acid is going to cause issues with pancreatic enzymes. So a lot of times fixing stomach acid fixes the pancreatic enzymes. I also see the other thing that I believe is mainly going on is visceral restrictions, which we're going to get into in a moment with slow motility. But basically there's fascia that has been bound around either the pancreas or the duct that moves pancreatic enzymes from the pancreas to the small intestine, or the sphincter of Oddi, which is like a little hole where everything comes through, and it has like a small sphincter-like action, meaning it can kind of open and close. If the sphincter is frozen shut, or there's fascial adhesions around the common bile duct that pancreatic enzymes are coming through, you can have some issues. So that the root causes of pancreatic enzymes is like sort of stomach acid, and then sort of visceral adhesions, which is actually number 2. So let's talk about the second big thing, which is visceral adhesions. So maybe you've never heard of visceral adhesions before. Maybe you've never heard of fascia. Fascia is like the connective tissue that binds everything together. And fascia experts, fascia researchers like to believe in that they're seeing that there's more fascia in your body than any other tissue. More fascia than muscle, more fascia than bone, more fascia than skin, more fascia than other organs. There is just more fascia. It's like, I like to call it the saran wrap of the body, where it covers bone, it covers muscles, and it's in muscles, and it's around muscles, and it attaches muscles to bone, and muscles to muscles, and muscles to muscles doesn't really happen. It attaches organs to bones, organs to organs. It's everywhere. It's just like material, and there's organized fascia, there's disorganized fascia, and your body can actually create more of it as a coping mechanism. And it will say, hey, this part of the body is not being supported enough. This part of the body received extreme damage recently. It could have been falling out of a tree. It could have been maybe doing a PR, like as you're adding on weight, like with weightlifting, for example, if you are doing it too aggressively, even if you're doing it at a healthy rate, your body actually doesn't just build fascia or build muscle. It builds fascia to reinforce, hey, this area of the body is being used a lot. Let's reinforce it with fascia. And that can be good until it's too much, too tight, too dense. And those what we could call visceral adhesions. And especially visceral means adhesions or fascial adhesions that are specifically affecting your viscera, which is your organs. Fancy word for organs. So visceral adhesions, that can be a part of a root cause of pancreatic enzymes. But what will happen here is that the visceral adhesions can actually keep your organ from rotating. I see this a ton. So you're like, who does visceral? Like, what is this visceral adhesion? What type of specialty does this? This training is from Jean-Pierre Barral, who created visceral manipulation. And visceral manipulation is what I did for since 2018. However many years that is now. Time is going on, age is going up. But I've been doing this in 2018 with my clients, and that was what I was doing before I did any lab testing, before I was doing any other types of functional medicine, supplements, protocols. I was doing craniosacral therapy and visceral manipulation, which addresses fascial restrictions in the body. Very different than myofascial release. Myofascial release is this deep tissue, very heavy-handed, strong release of fascial adhesions around muscle. That's the myofascial. Myo is Latin for muscle. Visceral adhesion, they're very different. You don't want to do them heavy-handed for like 99% of the time. Your organs are very gentle little creatures, and it would just freak them the heck out. And it's not effective on the adhesions. So visceral adhesions, I had a bunch around my small intestine specifically, and we can get into anatomy like all day long. And I actually do in podcast episode 90 called Fascia 101. And I really jump into some more of the anatomy behind fascia. There is so much anatomy, way more than maybe anyone was signing up for when they clicked on this episode. But really like a surgeon's level of knowledge of anatomy, which is a lot of my anatomical knowledge comes from books that have been used primarily by surgeons to understand the body. And so it's wild. And so I would have clients come in and say, I have slow motility. And yeah, we're going to do functional testing for some of the other things going on here, including the low digestive enzymes. And we're going to do protocols that might involve supplements, but we're going to do visceral manipulation. So one of the biggest things to understand is, one, how to find someone near you who can evaluate you with this. And unfortunately, there's no like one type of practitioner who does this. It's not like chiropractors do this or physical therapists do it. It's anybody who's a body worker, meaning they can touch you legally. So occupational therapist, chiropractor, acupuncturist, massage therapist, anybody can learn this, and they just have to have the training. So where I actually put together a resource or a tool for you to be able to find someone near you, just go to betterbellytherapies.com/find, and you can use that resource to find a qualified practitioner near you who does visceral manipulation. And then the other thing is, I will say in our program, my program, the Better Belly Blueprint, in module 4, I actually teach people how to do 3 self-evaluation techniques to identify if and where they have visceral adhesions, and 3 at-home exercises they can do to help release them. I would say I did those 3 exercises for months when I was rehabbing myself, but I did it alongside also getting treatments from a health practitioner who specifically was a pelvic floor therapist who knew how to do these techniques. And if for severe restrictions, you really do want to have like a qualified practitioner working on it. So that's visceral adhesions. And something else to keep in mind here with visceral adhesions, this is like a pet peeve of mine when people say, I have slow motility, so I'm going to do, I heard the vagus nerve is a part of motility and creating motility, so I'm going to do vagus nerve stimulation. And maybe they do notice improvement of their motility with vagus nerve stimulation. It's a real thing. Like vagus nerve stimulation can help, but also consider why is your vagus nerve so unhappy? Why? What is it itself? It doesn't have a brain. Now it has 2 attachment points. It attaches into your brain. So maybe it's the brain causing the issue and not the vagus nerve. Or the other part that it attached to is in the gut. So maybe it's the gut sending signals to the brain that's causing the issue. So then now you want to treat the gut. The only other place it can happen is alongside the nerve. My hands are like over here. Alongside the nerve. If you have a nerve running down from your cranium all the way into your gut, that's a very long nerve. We call it the Latin, I think vagus, if I remember correctly, means wandering. It's this very long nerve that it's the only cranial nerve that goes this distance, meaning cranial nerve means it's plugged into your brain. It's not plugged into your spine like all these other nerves you're dealing with. It's plugged into your brain. It's the only one that goes this far, right? So it's a very long distance, and it travels, like as it comes down out of your head, it travels behind your trachea alongside the left and right side of your esophagus, right? So if you're having neck issues, if you're having swallowing issues, there might be pressure or visceral adhesions around the vagus nerve. And that's what I have found is people say, well, I think I have a vagus nerve issue. I just need to do some meditation or mindfulness or stretches or vagus nerve activation. And I'll be like, let's just try visceral manipulation. And we mobilize the nerve and get it out of its adhesions and it functions better. So I would actually put, visceral adhesions are a more root cause. I'm going to try and like fit vagus nerve in here to a vagus nerve in my experience. Vagus nerve is like sandwich in between it. It is a more root cause than the vagus nerve. That's number 2 for why you might have slow motility. Get your fascial adhesions checked out. Number 3 is mold. Mold is its own category. Why? Because, and I talk about this in episode 221. Highly recommend if you want to learn more about mold. It damages the myoenteric plexus. I'm even going to write it on my little sheet here. Myoenteric plexus. And that is, myo is muscle, enteric is the name we've given the gut nervous system, and plexus is just like the command center for like the gut's ability to nervous system wise speak to the muscles. It damages your gut's nervous system ability to talk to the gut muscles to say move. And that's in the mold's favor. It wants to paralyze you and your body because then it doesn't get brushed along and taken care of and pooped out. It can really plant itself in your body. So it wants to basically paralyze you. Think like how a snake has poison and it can paralyze you. Mold basically wants to paralyze your gut. And so very, very important. If you want to listen to more episodes on mold, go to episode 221. And it's in the middle of a mold series that I did, and it'll cover a lot of basic questions. Also do subscribe because I have a mold series coming up, like another big one coming up in later this year. So if you want to be in, like, I'm going to be covering lots and lots of questions that we didn't get to in our last series. So be sure to subscribe either on your podcast host that you listen to this podcast, or even better, go and subscribe so you can get an email update when new episodes come out. Go to betterbellytherapies.com/subscribe and we will email you when all our new episodes come out, but especially the mold series that is going to happen later this year. That's number 3 for slow motility. So if you have slow motility, I'm testing for mold, and we're going to get to tests in a second, tests that we would do for each, but we want to test for mold. We don't want to be like, I don't have mold. My house doesn't smell moldy, because what'll happen is if you deny the possibility of it and it is an issue and you deal with all these root causes, but mold, you might still have slow motility. You really want to dig under every rock and just be open to like, this might be an issue for me. So next, I would say we have number 4, other pathogens. And this was big for me. So like one of my pathogens I had was a parasite called Blastocystis hominis. It's an invisible parasite, meaning it's microscopic. It's not totally invisible. It's invisible to the naked eye. So don't think like a worm. It's an invisible parasite. It's microscopic, Blastocystis hominis. As soon as I got rid of that, my constipation like massively improved. It was between the parasite and the thing that made the biggest difference for me was the parasite and visceral adhesions, so visceral manipulation to release it. But I also had low stomach acid, for example. I also had H. pylori. So it was dealing with all of these things, which I hadn't even gotten to H. pylori. H. pylori, we talked about in the stomach acid episode. It's a potential root cause of stomach acid. So they're connected. Other pathogens might be C. diff, might be Lyme or Epstein-Barr virus. But those are actually, even though they're really annoying and hard to get rid of, they are not primary. And I do talk about that. If you want to learn, if like Lyme and Epstein-Barr virus are on your radar and you want to learn more about why they're not primary, go check out episode 239 and 250 for those 2 little guys. All right, that's other pathogens. That's number 4. Number 5, the 5th root cause you want to look into is nutrient deficiencies. This was a big one for me too. I do feel like I had a lot of these, and I think my nutrient word looks, I'm just going to rewrite this whole thing because it looks funky. nutrient deficiencies. So there's a lot that we can be talking about. Unfortunately, when it comes to constipation, the only nutrient that really gets talked about consistently is magnesium. And that's like, it needs to be included in the conversation, but it by no means is the only mineral that can cause a constipation. And so we're really thinking also about sodium. And I get into that in episode 232. And potassium, I do briefly mention it. Na and K, those are their little markers on the periodic table of elements. Zinc deficiency, primarily because of its correlation with low stomach acid. Oops. So zinc deficiency can be a big component of that, and go listen to last week's episode. And then those are the primary nutrient deficiencies, and I'll get into testing in a second. Number 6, the sixth biggest root cause is going to be food sensitivities, mainly because they introduce a lot of inflammation. So if you're sensitive to gluten and you're eating it, and you may or may not know you're sensitive to gluten, you might not have GI symptoms, by the way. I get clients who, I'm not sensitive to gluten. I went off gluten for a month and I didn't have any improvement in my gut. You could have other symptoms from gluten sensitivity. But you're eating some food you're sensitive to and you don't know it. Or you know it and you're still eating it. Either way. It just introduces a lot of inflammation. And so that in and of itself can really clog up the body and it slows down. Think when you roll your ankle and there's a lot of inflammation, what happens to the ankle? It puffs up. And then what is it hard or easy to walk on a puffed up ankle? Not only might there be some pain, but it's puffy. It's hard to get your socks and shoes on. It depends on how puffy it is, but it can be really hard. Inflammation is an actual thickening process because it sends all these different inflammatory markers to one single site, and it can really just clog up and fill up. It's kind of like a car accident on the highway where you don't just have your normal cars now. Now you have the car accident itself, which might have an odd shape to it, and then you also have the fire truck and the emergency vehicles and the police cars. It just takes up a lot of space. Same thing. And when it comes to inflammation from food sensitivities. And lastly, but not least, is thyroid. Thyroid is so special. It gets its own episode. We're doing it next week. I'm very excited. So I'm not going to dive into it now, but just to say, when you have, especially hypothyroidism, when you have I should really say hypo, meaning insufficient hypothyroid hormone, or even if you have sufficient hypothyroid hormone, meaning T3, but it can't access your cells. And there's a couple reasons for that, but one of them might be insufficient progesterone, low progesterone can give you hypothyroid symptoms because your thyroid hormone, even if there's sufficient amount, can't board your cells to tell it that, hey, thyroid's here, hello. You'll get hypothyroid symptoms, which can be cold hands and feet, dry skin, thinning hair, weight gain, fatigue, but it can also be slow motility. Everything slows down. The body's ooh, and it slows down, including the motility. So thyroid is something you want to be thinking about. We don't even need a test for it. And I'll get into it next week, but it's wild. You don't need to go find an endocrinologist today or tomorrow. You can if you want to. You don't need to test your thyroid. You can if you want to. It's more data, but interestingly enough, it won't tell you what to do or what to heal. And I will tell you next week in the real root causes. Very controversial. I'm going to say thyroid is not a real root cause. I'm curious how many people are going to get pissed at me. I'm going to make a case for it. I'm going to describe it. But yeah, I could still see people just not liking it for one reason or another, which is fine. But this is it. When we deal with when we treat all these things or test for all of them, test first, kind of get an idea of what are we dealing with? Is there mold? Is there visceral adhesions? Are there other pathogens? Which ones? Are there nutrient deficiencies? Which ones? Is there digestive enzyme issues? Which ones? Now we can create a map of what to do about it. And so the testing that we're going to be looking at is going to be the GI map and the OAT for pathogens, primarily for pathogens, also for digestive enzymes, a visceral manipulation evaluation, and again, we have those like 3 at-home evaluation techniques that we teach in the Better Belly Blueprint at betterbellytherapies.com/blueprint, but also it's really great to get an evaluation from a professional. I've gotten professionally treated. I am a professional visceral manipulation practitioner. I've been a teacher's assistant in courses for it, teaching other practitioners how to do it. I still get treated by an expert because it's very hard to treat yourself accurately and with full insight. It's very easy to be biased by your own body's feelings and stuff. So GI map and OAT for pathogens, including mold, visceral manipulation for visceral adhesions, and HTMA for a nutrient deficiency and food sensitivities. I like to do the Zoomer. If you haven't heard about the Zoomer test, what episode do I have it here or written down already? Yeah, episode 267. If you're like, what is that food sensitivity test? Please just stop doing the MRT, the Viome, Tiny Health. Go listen to this episode and why it's so superior. You're going to save yourself a lot of time and money. It's going to just be more effective. And for hypothyroidism, we're going to dive into it next week. You're not going to just do a blood test for thyroid. You're going to do something else. And then after you get these results, you now have the information you would need to put together what I call vitality protocols, and then pathogen protocols, and then like stomach acid. Some of them are quote unquote dangerous stuff you just don't want to do sooner. Stomach acid, copper. There's some protocols you just want to wait to the end. And we teach you how to do all that, like front to back, just like one smooth, one continuous operation inside of the Better Belly Blueprint. So if you want to join, there's no wait list. You can join now, get all this information in modules that literally take you step by step through every part of the process of which labs you uniquely need to order, how to evaluate them, how to create your own custom protocols, and then how to walk the protocols out to get results. And you can do that today. So for the new year, like feel amazing for the new year. Not have slow motility by the end of 2026. Amazing. I mean, it's life-changing. You don't have to be trying and search around for like slow motility supplements. Like, again, one of my pet peeves, someone says, well, I've been taking Senna for my slow motility. You're not deficient in Senna. Senna might help you temporarily, but most of my clients, it either never helped or it like only mildly helps. And so they're just looking for some stronger supplement, and what you need is to look at the root causes. And you'll always get rid of your slow motility. And I say that I say always out of my clients. Maybe there's some case where it wouldn't work, but this has been like killer. This is gold. If someone showed this to me in 2015, I wouldn't have had to go through 2 years of suffering. But here it is. All right, that's it, guys, for today's episode. Be sure to subscribe to get our next episode on the thyroid and how it's not a root cause and what to do instead. And you're going to want to care about it, whether or not even if you've never been diagnosed with anything thyroid related, it is still super juicy, super helpful, important, because you can have thyroid symptoms and thyroid issues even with your thyroid levels being normal, and there are still things you can do to help yourself. So that is it. I am going to bow out for today, and I'll see you guys next week.
Hey friend, I hope you loved this episode. If you've been a fan for a while or newly loving this podcast, can you do me a favor? Drop into Apple Podcasts and leave me a review. When you leave a review, you do so much. You help me know you're listening. You can tell me what you're loving so I know what to make more of. And you help others by boosting this podcast so other people like you can find the podcast too. I mean, it's a win-win-win, right? So if you want a way to pay it forward, just go to Apple Podcasts or click the link in my show notes and leave a rating and review. And if you want some more free stuff, just head over to my free Facebook group, betterbellytherapies.com/Facebook, and you can get access to all of my free support for you, including some Facebook group exclusive stuff like my podcast episode vault, where you can search the Better Belly podcast by topic and find exactly what you need to expedite your healing. I cannot wait to see you in there. Catch you guys next week.